A visit to the Accra Psychiatric Hospital revealed the sad reality as to why most mentally challenged persons have pitched camp on the street as their homes. This is the special ward at the Accra Psychiatric Hospital where mentally challenged patients are kept. A patient, Lolonyo, not his real name, has been here since 1983. The 64-year-old man has given up in life. He tells me he doesn't feel like going back home anymore because he cannot trace his family. He will die here at the hospital, never setting foot at home again.
Any of your family members looked for you?
This I'm saying, nobody at all.
So do you sometimes feel sad that you don't really locate your family members again?
At all.
Even though he is in a better state now, he tells me life in the hospital has not been easy for him.
I said, I make Kulma finish. So I make Kulma, so I have nothing to say about that.
Don't you have ambitions that you want to achieve?
At all.
Another patient, Kwame, not his real name, had a brain infection through an accident. He became mentally deranged and pushed his father to death. Kwame has also been here for the past 18 years now.
Night I had an attack and the body pushed me twice. So the third time I also pushed the body. When they break, they said I've killed my father. So that's my tragedy.
Kwame tells me his wife immediately divorced him when he was admitted at the hospital. Kwame is partially blind and believes it is as a result of years of medication to cure his brain infection. Now, he spends his time on knees talking to God.
I'm having children before I came here. When I came here, my wife went away, so I'm now a single parent.
Kwame still nurses dreams of becoming either a police officer or an immigration officer.
If I get a good job to cater for my children and to live up to expectation.
The special ward has about 10 rooms housing over 50 patients. Some parts of the rooms bear visible cracks. There are no fans or wider windows for good ventilation. Due to the lack of beds, some inmates are compelled to lie on the bare floor without clothes, especially when it rains. Richard Kwao, a senior staff nurse, has been working here for 3 years now. He says feeding is a challenge in the ward.
Lolonyo has been here since 1983. He's one of the few patients who have actually recovered from his condition. He's a current patient now who is well, who is even assisting some of the staff in helping managing the ward and everything.
He called on relatives of the treated inmates to come for them in order to ease the strain on the scarce resources available at the hospital. The director of the Accra Psychiatric Hospital, Dr. Pinaman Apau, says the limited funds available at the hospital makes it a total strain keeping cured patients. She says it has been difficult to trace some families of the mentally ill patients.
They do not really remember where they're coming from. In the folder, we write details and so on. But remember that some of these people have been here over 20 years, over about 30 years, and folders are torn, folders are missing. The Mental Health Authority is looking at halfway homes. All right, so halfway homes would be a place where people who are well and can be put back into society.
A tour across the major towns in the country's capital, Accra, has revealed that a lot of mentally ill patients, both young and old, have been abandoned on the streets. It has been about 6 hours strolling at some parts of Accra, and I have recorded about 300 mentally derailed people who have been left on the street. Now, the number of mentally derailed persons who have invaded the streets of Accra is causing public obstruction and nuisance, as pedestrians are afraid even to walk on the streets when they find mentally derailed persons around them. Back at the Accra Psychiatric Hospital, Lolonyo and Kwame still pray to be back home before they die at the hospital. For GH1 News, Godwin Asediba. A visit to the Accra Psychiatric Hospital revealed the sad reality as to why most mentally challenged persons have pitched camp on the street as their homes. This is the special ward at the Accra Psychiatric Hospital where mentally challenged patients are kept. The last time I visited Accra Psychiatric Hospital was 7 months ago when I reported on the bad state of the hospital special ward, or the forensic ward if you want to call it. Now, after I reported on the bad state of the ward, Benevolent came in to help. As I am speaking to you, the hospital special ward has been refurbished. The deplorable state of the special ward was an eyesore. A report drawing attention to it was carried by some online portals like star.com.gh, and the public was dismayed. This is the new state of the ward. The facelift was overseen personally by former Minister of Defense and board chairman of the Social Security and National Insurance Trust, SNIT, Dr. Kwame Adokufo. The special ward now has a secured and modernized dormitory. It also has, among others, a designated nurses station, dining hall, and a circulation room to specially attend to patients with extreme conditions. Before the renovation, a patient, Lolonyo, not his real name, told me he had been abandoned at the hospital since 1983.
I said, I make Kulma finish. So I make Kulma, so I have nothing to say about that.
Don't you have ambitions that you want to achieve?
Not at all.
Today, the 64-year-old man meets me with smiles. His abandonment fathers from his mind. He looks forward to the comfort to be gotten from the renovated ward.
Oh, well, with the patient there, you don't get any reason I thought to see. It look nice. Toilet, bathroom, watching, very nice. Yeah.
Another patient, Kwame, not his real name, has been here for 19 years. Kwame's old cubicle was full of cracks, a state the renovation has corrected.
I'm proud to say I'm a patient at a special ward, Accra Psychiatric Hospital. Formerly, it was full of mosquitoes, bed bugs. Now that we are free from those crawling insects and so on and so forth. If any praise, I will first and foremost give you a praises. You are doing a great job.
At a brief handing over ceremony, Dr. Adokufo said the gesture was born out of his love for humanity and the need to give back to society in commemoration of his birthday.
Got a project called the Samaritan Project, that we need an ambulance, a rehabilitated place, so that whenever you see anybody lying on the pavement or roaming about almost naked in the street, that ambulance will pick him up or her up and bring. We've got another project. But for that, we need the religious bodies, corporate organizations, and to some extent government to be able to effect it.
The director of the Accra Psychiatric Hospital, Dr. Pinaman Apau, said the ward was designated to accommodate only 60 patients, but at some point in time was accommodating about 260, sadly with only 20 beds. She was thankful to GH1 TV for drawing attention to the situation.
We believe that it's part, getting results is part of what you did for us. I mean, you were part of us getting the results that we have now. And we are grateful to GH1 for everything that you do for us.
Back at the special ward, the patients were seen playing games with excitement all over their faces. They showed their appreciation to GH1 News.
God is good all the time. And all the time,
God is good.
Thank you, GH1. Thank you, Godwin.
All right, it's so exciting to know that after this report was aired on GH1 television, these patients get to smile again. And surprisingly, GH1 TV is their favorite channel. When I and my team got here, they were busily enjoying themselves with Rhythm Live that is currently showing. My name is Godwin Asediba reporting for GH1 News. Thank you.